At my age, you know I've been to a lot of doctors. Healthcare partners, they really care. They're concerned about your health. They're all the best. I am Roberta, and I am a healthcare partner. Visit hcpnv.com to hear my story.
I'm actually a board-certified internist, meaning I specialize in adult medicine. I practiced for 10 years, starting in 2000 when I opened up my own practice in Green Valley. Then I went on to become a medical director of an insurance plan for about 4 years. And when I heard about Mr. Kelly and Mr. Adams and his vision for the hospital and developing a more integrated network and having more physicians come up to Pahrump, it looked like a great opportunity for me, and decided to join their multi-specialty physician group.
Are you permanently here now, or do you still have your office in Green Valley?
No, I actually closed my office in Green Valley, and I'll be here in Pahrump full time.
Wow. So you're taking patients now here, or have you started?
Starting September 16th, I'll be taking patients. There is an office right outside the hospital, right outside the ER, and that's where I'll be practicing 8 to 5. And on call, meaning after hours, absolutely. I'll be taking my own patients' calls, and if there's any emergencies, they would be able to come here right to Pahrump ER.
What is the common visit like for an internist?
For internists, it's very similar to family practice. So it can be anything from you have a sore throat to an earache to a new cough, or maybe abdominal pain, to more chronic diseases. We actually specialize in chronic diseases, so that can be everything from lung disease, from smoking too much, or heart disease and diabetes.
And you said adult patients.
Yeah, we typically, the difference between an internist and family practice is the internal medicine, we focus on adult medicine, anything from the age usually around 15 and up. Family practice tends to have more pediatric patients, and they can do adult medicine, but our focus is really adult medicine.
You're welcome on board here at Desert View Hospital. Tell me a little bit about what you've been thinking about the facility and the town itself.
But the reason I wanted to come to Pahrump was exactly what Mr. Adams was describing. I wanted to be able to keep my autonomy and being able to deliver highest quality of care based in customer service, which is really what we want to be able to do, is that, again, Marcus Welby factor.
What's a delivery system?
So we have solo practice doctors like what I was doing. And what we want to be able to do is really bring coordination of care. So in coordination of care is my integration with your heart doctor. With the patient, when they go to the hospital, I want to integrate with their hospital doctors. I want to be able to integrate with the hospital itself. These are new models of delivery. It's just integrating the entire continuum.
Is that going to be done technologically, like keeping track of your prescriptions, and then what your last doctor said on their visit too as well, and all the doctors being able to read the notes from the other doctors?
Absolutely, and I think you just brought up one of the biggest parts of when we talk about the new delivery models as healthcare moves forward into the 21st century, is the ability of our electronic medical records to seamlessly allow us to interact together.
Can they call and make an appointment?
Yeah, making an appointment is at 751-7100.